war is ugly, and so the baggage that comes with it is terrible.
We have reminders of the people who served our country scattered across the city, like the Royal Winnipeg Rifles Regimental Monument at Vimy Ridge Park. And while these names engraved in stone represent just a small fraction of our fallen soldiers, there are also 460,000 names we won't find engraved anywhere, of our veterans across Canada who may be off the battlefield but continue to fight to improve the well-being of veterans and their families everywhere.
My great-grandfather served in World War I, injured at Vimy Ridge. My grandfather served as a fighter pilot. My dad and my mom both served in the military.
Veteran Paul Hook, who served in Afghanistan in 2005, is now the fourth generation of his family to have served and retired. He knows better than anyone how much support veterans need after they transition into civilian life.
It's not a Canadian issue. It's a whole world issue with all of the military members and veterans.
He calls himself lucky in having a positive experience transitioning out of service, but knows many everywhere struggle to do the same.
Over the life course, up to 6 out of 10 military veterans will have depression or anxiety or a substance use problem sometime in their life.
Jatinder Serene, department head of psychiatry at the University of Manitoba, says while improvements have been made in the aftercare of veterans in the past 2 decades, there's still a gap in how quickly people can get the different kinds of care they need.
The majority of people, when they get the right treatments at the right time, they actually recover. Often the challenge is not having enough of those resources in a timely manner.
Jay Serene, a medical student studying injuries from first responders, says he sees a parallel between them and military veterans. He believes a huge gap in care lies in stigma surrounding PTSD and hopes more open conversation about mental health can help.
This can go a long way in ensuring that these individuals aren't alone in their trauma, and we can serve them the way that they've been serving us.
It's to make them understand that they still have the freedom that they have based on the choices they made to serve their country.
It's why veterans like Hook have teamed up with researchers like the Serenes so they can be at the forefront of improving the care veterans get in civilian life.
I don't regret a day I spent in uniform. It was so much fun. It made me understand and discover who I am as a person, who I am as a Canadian.
In Winnipeg, Joanne Roberts, City News.